for my part, I will be discussing two things. I will be discussing newborn care and yung Frischmond, kung paano nga ba ginagamit yung Frischmond. Okay? So first, let's start with your newborn care. So for this segment, we will be talking about yung well baby. Okay? So hindi kasama yung resuscitation ng batang toxic or yung bagong panganak na may complications. We will limit our discussion for the well baby care para mas ma-discuss natin siya in detail. Otherwise, pag nag-discuss pa tayo ng resuscitation, hindi na tayo matatapos, mahabang discussion yon. Okay? So, the outline for this lecture, number one is preparation before catching a newborn. So, during your rotation as clerks and as interns, there will be times na you'll be asked to assist the resident to catch and attend to a newborn delivery. Okay, and depending on the institution, in some institutions, you'll be the ones to catch the newborn on your own. So, you have to know what to prepare, okay, what to do when you are going to attend to a newborn delivery. Number two, we will be discussing essentials in intrapartum and newborn care with a specific focus on the part of the newborn care. This segment I already discussed in detail during your Genesis discussion. Okay, pero we will show you some videos, some clips, and we will show you some updates. So, yung dating discussion natin ng EINC is more theoretical. This one is more practical. Okay. And then I will tell you what you need to do when you're the ones assigned to do your rounds, okay, in the newborn ward. So, pagkapanganak, tuturuan natin kayo kung paano mag-catch, ano yung mga kailangan gawin. And then of course, ano na ba yung mga next na kailangan yung bantayan pag nasa ward na sila. And lastly, preparation for discharge. What do you instruct the mother? What do you instruct the parents? Kung ano yung mga kailangan nilang gawin when you discharge these well babies. Okay? So, for the preparation part, okay, so first of all, most importantly, bago kayo mag-catch ng newborn, you have to have a good and thorough maternal history. Okay, so you have to interview the mother para alam nyo kung ano yung in-expect nyo. Okay, when attending to a newborn delivery, guys, kung magka-catch kayo ng baby, preparation is very important. Pag merong history na, kunwari, preterm yung delivery, then mas marami kang in-expect na complications dun sa baby niyan. Pag may kung aspirated yung baby, pag sinabi sa inyo na, for example, meron siyang leaking bag of water, tapos napansin ng OB na parang may kung yung stain na yung bag, then yung amniotic fluid, then mas in-expect mo na baka mas kailangan mo mag-resuscitate ng airway. So, very important yung good and thorough maternal history. Okay, so things that you should ask but not limited to. Okay, so ito lang yung mga pinaka-basic, guys. You can look in your Pedia Platinum, nandun yung very detailed kung ano yung lahat ng kailangan tanungin. Pero ito yung minimum na kailangan tinatanong, and these are the parameters that I usually ask when I interview the mothers who are about to deliver. So of course, yung age ng mother, yung parity and gravidity, you have to ask kung meron ba siyang prenatal checkup. That's very important. So kung nakakailang prenatal checkup na siya, what are the workups done? So CBC, may anemia ba si mother? Okay, pag may anemia si mother, bakit? Diba? So you have to expect those kasi baka mamaya paglabas si baby, baka magkaroon siya ng cardiorespiratory problem, kailangan mo mag-resuscitate ng volume. Okay? So infection, tingnan mo kung may infection si mother, urinalysis, okay, GBS screening, HBsAg. Pag merong hepatitis infection si mother, then you have to prepare your hepatitis B immunoglobulin, okay, and your hepatitis B vaccine. Dahil pag HBsAg positive, diba? We have to give our Hep B vaccine plus immunoglobulin within 12 hours. Okay? And other conditions such as syphilis, okay, yung mga test natin for that, OGTT, okay? You have to ask for maternal illness. Drug intake is also very important. And other tests, okay? Congenital anomaly scan. Baka mamaya, nag-expect ka palang mag-catch ng baby na anencephalic or may hydrocephalus. So, all of these things you have to know to be able to prepare, okay? Kung yung ika-catch mong baby ay healthy ba siya or hindi. So again, for this discussion, we will limit ourselves to a well baby, okay? Next that you have to prepare is your delivery setup and resuscitation team. So remember, majority of the deliveries will be normal, okay? And only a few babies na will be delivered na magkakaroon ng problem, okay? But you have to be ready for these babies, and that's why it's very important na sa lahat ng delivery, dapat prepared kayong mag-resuscitate, okay? Hindi pwedeng, ay normal lang to, hindi na ako mag-ready ng oxygen ko, hindi na ako mag-ready ng suctioning machine ko, okay? So even if it's a normal delivery, okay, you can never tell what will happen, okay? So you have to prepare for the worst, okay? So very important, it's part of your EINC, the temperature of the delivery room should be regulated to 25 to 28 degrees Celsius. So that's the normal temperature, okay? When attending to a delivery, dapat 25 to 28 yan to avoid hypothermia. Para hindi maging hypothermic yung mga babies. Again, hypothermia is very detrimental for your newborns, okay? So, nangyayari ba ito in practice? Ideally, dapat, okay? Pero kung minsan, lalo na pag yung mga OR complex ay naka-aircon, kung minsan, masyadong malamig yung delivery room. So, make sure pagpasok mo doon, check the temperature. If it's too cold, you ask the nurse na kung pwede ba hinaan or pwede patayin yung air conditioning system. Okay? Ideally, there should be 2 personnel trained in newborn resuscitation. Okay? So, dapat dalawa yan. Okay? If you attend your newborn resuscitation workup, especially pag toxic yung baby at kailangan nyo mag-resuscitate, the minimum number is 2. Okay? So, 2 or more dapat yung nag-resuscitate. So, they should be trained personnel. And in your case, probably in the setup in your hospital, one of which is yung pedia resident nyo, okay? Plus or minus yung consultant, tapos kayo yung pangatlo. Okay? And then we prepare the materials for your essential intrapartum and newborn care. Ano ba yung mga yun? So, we will show you a video later, pero ito yung breakdown ng materials na dapat yung pinag-prepare. You should have 3 pair of sterile gloves, okay? 2 of which gagamitin ng OB and isa for the pedia. If isa lang yung magka-catch, in some institutions, ganun yung nangyayari, yung magka-catch ng baby, siya na rin yung mag-attend kay, yung magpapanganak, siya na rin yung mag-attend kay baby, then yung OB na yun, pwede siya mag-double gloves, okay? Yung double gloves na yun, tinatanggal yung first layer before holding and clamping the cord para sterile yung paghawak sa cord, okay? You have to have 2 warm blankets. Ito madalas nakakalimutan. So, dapat dalawa yan, guys. Yung unang blanket nyo, yun yung ipang-dry nyo kay baby paglabas ni baby. And the other one, yun na yung ibabalot mo kay baby. Yung pinangtuyo nyo, mababasa na yun. So, discard na yun. Kasi yung iba, pagkatapos silang tuyuin, yun pa rin yung ipang-wrap nila kay baby. Again, that will cause hypothermia. So, dapat dalawa yan. And ideally, these blankets should be pre-warmed. So, dapat warm blanket yan. Okay? A bonnet, you need a bonnet because you will put that kay baby as you are doing your skin-to-skin contact. Of course, your cord care set, your cord clamps, eye prophylaxis, vitamin K prophylaxis, and your Hep B vaccine. Okay? Materials for resuscitation. If mag-toxic si baby, if and when you need to resuscitate, you also have to prepare these materials. So these are the list of materials that you need to prepare. Your oxygen supply, of course. So ideally, meron kayong O2 blender. If you're not familiar with an O2 blender, guys, kapag nag-supply kasi kayo ng oxygen dun sa oxygen tank lang, what you can control is the flow, diba? 1 LPM, liters per minute, 2, 3, 4, okay? If you have an O2 blender, aside from the flow, you can also control yung percentage, yung FiO2 nyo, okay? For newborns, ideally, you resuscitate at around 21 to 30% FiO2 lang. So depende yan kung full term yan or preterm, again, outside the scope of this discussion, pero it's around 21 to 30% FiO2 kung may available kayong oxygen blender, okay? Suctioning equipment is also very important, okay? Pag maraming secretions, kapag may aspirated, kailangan nyo mag-clear ng airway, you have to have your suction machine. Okay, your bag mask valve ventilation apparatus, so your ambu bag with, of course, appropriate, okay, appropriate size na, what do you call this? Yung ginakabit sa mukha, face mask, tama ba? Basta yun, okay? Your intubation equipment, of course, your laryngoscope, Okay? Materials for umbilical catheterization and other IV access. So, kunwari, nagkaroon ng placenta previa mother, nag-shock si baby, kailangan mo mag-bolus ng fluid. So, you have to have an access, okay? So, kung hindi mo siya malinyahan agad ng mabilis sa peripheral IV, you can do your umbilical catheterization. Pag wala talaga, you can do intraosseous. And of course, essential medications and fluids, plain NSS, epinephrine, usually yung dalawang mga kailangan, okay? So, you have to prepare all of these, okay? Kung kailangan nyo mag-intubate, okay, we always suggest that you prepare your ET tubes ahead of time. So, in units, guys, yung ET size na ginagamit natin is based on the weight. So, if your baby is less than 1 kilogram, so you can see in this table, merong weight, may gestational age. In practice, usually sa weight kami nagbe-base. If it's less than 1 kilogram, the size of the ET tube, the internal diameter is 2.5. Okay? If the baby is 1 to 2, it's 3. If it's 2 to 3, it's 3.5. For more than 3, it's 3.5. Madaling tandaan, ang mnemonics namin dyan, 1, 2, 3. Okay? 1 to 2 kilo, that's 3. So, from there, mag-adjust na lang kayo. 1 to 2, that's 3. 2 to 3, 3.5. More than 3, 3.5 pa rin, pataas. Pag less than 1, 2.5. Okay? And how deep do you insert the tube? The formula for that, for the depth of your ET tube, that is weight, okay, in kilograms plus 6. So for example, you have a baby who is 2.5 kilograms. So kung 2.5 kilograms yan, yung ET tube mo dapat 3.5 and yung depth mo, that's 2.5 plus 6 is around 8.5. Okay? But again, you prepare one size smaller and one size larger. Okay? So again, these are just formulas for estimating the size of the ET tube. Okay? So please watch your video on your essential intrapartum and newborn care. So please watch that, okay? And we will continue our discussion after watching that video.
6, 7, tuloy-tuloy, 8, 9, 10, maybe 7:40.
What you are about to witness is a video illustrating the step-by-step essential newborn care protocol developed by the Department of Health. This protocol adopts international evidence-based standards set by the World Health Organization. They directly address the Millennium Development Goal of reducing child mortality. The Philippines is among 42 countries that accounts for 90% of deaths among children below 5 years of age globally. Studies have shown that 70% of newborn deaths may be averted during labor, delivery, and immediately postpartum. In short, it is in the first few seconds and minutes of life that every newborn Filipino is given the chance to survive and to have a better life. During those first few moments in the arms of a mother, during the first embrace, sa unang yakap. For this training video, take note of the running time displayed at the left-hand corner of the screen. This indicates the period within which the protocol must be carried out. Let's start with the preparation. Lay out 3 pairs of surgical gloves, 2 of which will be used by the obstetrician, and the remaining pair for the pediatrician. 2 warm blankets, a bonnet, cord care set, the erythromycin, vitamin K, and hepatitis B shot. Wash your hands following the prescribed 1, 2, 3, 4, 5 counts for each movement. Put on both sets of gloves. This is the double gloving step. During the first 3 minutes within birth, here are the correct procedures prescribed by the Essential Newborn Care Protocol.
Maybe 7:40.
Once the baby is delivered from the perineum, call out time of birth. Use the first linen to towel dry the body of the newborn. Dry the baby for at least 30 seconds. This will stimulate the baby to breathe. Do not wipe off the vernix, as this continues to provide a natural protective cover for the baby. Do not wash a baby within his first 6 hours of life. Washing could lead to hypothermia and infection. Carry out a rapid assessment of the baby's breathing as you dry the newborn. Remove the wet cloth. Initiate the all-important skin-to-skin contact by placing the baby prone on the mother's abdomen or between her breasts. Place the bonnet on the newborn's head. And use the second linen to cover the baby's back, both to keep the infant warm. The next step is removing the first set of gloves prior to handling of the cord. Do not cut the cord immediately. Allow the cord pulsations to stop without milking the cord. Clamp the cord at 2 centimeters from the base of the umbilicus. Apply the second clamp at 5 centimeters from the base of the umbilicus. Cut the cord. Waiting for 1 to 3 minutes or until the cord pulsations have stopped prevents anemia and protects preterms from intraventricular hemorrhages. Inject 10 IU of oxytocin into the mother's arm to prevent uterine atony. While maintaining the skin-to-skin contact, check on the mother's condition and deliver the placenta. Check how heavy her bleeding is and examine her perineum, lower vagina, and vulva for tears. Clean the mother and keep her comfortable. Skin-to-skin contact, or SSC, is essential to creating the bond between mother and child, increasing the chances of overall success of breastfeeding. Allows colonization with good bacteria, protects the baby from hypoglycemia. At about 30 minutes to an hour after birth, the baby will start licking, rooting, and tonguing movements, cues that he is ready to breastfeed. Encourage the mother to nudge her newborn toward the breast to seek out the nipple. Counsel on positioning and attachment. After the baby completes his first breastfeed and detaches from the breast, while he is with his mother, carry out the eye care procedures and administer vaccines. Let the infant remain in the mother's arms as she recovers from giving birth. The newborn stays with the mother as she is brought to her room or the ward. The baby may be washed after at least 6 hours. The Global Infant and Young Child Feeding Strategy recommends giving the baby nothing but breast milk for 6 months. After 6 months of exclusive breastfeeding, child can continue to breastfeed in addition to other foods up to 2 years of age or beyond. To summarize, here are the step-by-step methods outlined in the Essential Newborn Care Protocol. Drying for at least 30 seconds with rapid assessment of breathing and tone. Early SSC or skin-to-skin contact. Proper cord clamping. Early breastfeeding initiation. Eye care, injections after completion of the first breastfeed. Rooming in. Exclusive breastfeeding for 6 months. As we adopt and embrace the principles of essential newborn care, we are closer to attaining the Millennium Development Goal of reducing child mortality in the country. As we, health professionals in maternal and newborn care, give each newborn a better chance at health and survival. It will mean changing how we move forward. It means doing things differently, using protocols that are evidence-based and time-bound. To sustain new life for those first few precious moments in the life of a newborn, in the life-giving embrace of the mother. Unang yakap, yakap ng ina, yakap ng buhay.
So, is that your first time to see that video? Medyo luma na yung video niyan guys. If I'm not mistaken, that's 2011, around 2010. Okay? So, I can still remember that time kasi nung nilabas yung EINC, yung unang yakap, we were interns and clerks. So, naabutan namin yung transition. Okay? Before, paglabas ng baby, lilipat mo na agad yung baby sa bassinet. Tapos na yung trabaho ng clerk, pedya intern on duty niya. Kasi bilis eh. Paglabas ng baby, clamp the cord, lipat sa bassinet, balutin mo siya, do everything that you have to do. Tapos na, pahinga na. Nung nilabas yung EINC, sabi namin, shit, ang hassle. May sobrang hassle kasi, yun nga, paglabas ng baby, babantayan mo pa siya habang nag-skin to skin siya. Kailangan pa matapos yung first breastfeeding. Kailangan at least 1 hour of skin to skin contact bago mo ilipat dun sa neonatal area nyo, bago mo makuha yung mga anthropometrics, bago mo magawa yung paperwork. Okay? But please remember again, guys, everything in EINC has a purpose. So we've discussed that in detail in your Genesis discussion. So I will not tell you right now kung ano yung mga yun. Everything has a purpose. You have to do that because it's for the baby. Okay? End result, it decreases maternal and neonatal morbidity and mortality. So you have to do your EINC. Okay? So it takes will. Okay? It takes discipline to do those set of practices. Dahil medyo mas mahirap siya ng konti. But again, it's for the patient, it's for the mother, it's for the baby. So here are some details, okay, and updates, okay, that you might have missed nung pinanood yung video. Okay? So that's from 2011, 2010 if I'm not mistaken. Pero up to now, halos yun pa rin yung ginagawa. Ano lang yung mga updates natin. Okay? In our newest set of recommendation from the Philippine Society of Newborn Medicine, okay, bathing, kailan nagpapaligo, sabi dun sa EINC video, 6 hours of life. Ngayon, our recommendation is after 24 hours. So, ideally, if you can wait 24 hours bago nyo siya paliguan. Again, to prevent hypothermia. So, thermoregulation is very important in the babies, okay? So, if you want to know kung kayo, ano nga ba talaga yung sequence of drying, may sequence yan, guys, pag tinuyo nyo si baby. And ito yung sequence, 5 seconds each, face, tapos head, the trunk, the back, arms, legs. So, total of 30 seconds, di ba? The first part is stimulation paglabas ng baby, drying and stimulation for 30 seconds. During that time, dapat makakuha ka na ng response na gusto mo, dapat umiyak na si baby, okay? Dapat hindi siya limp, okay? So, there's a specific sequence if you want to be ok about it. Again, head, trunk, back, okay? Oh, sorry, head, face, trunk, back, arms, legs. 5 seconds each, total of 30 seconds, okay? Uninterrupted skin-to-skin contact. Depending on the reference that you're reading, some references will say 30 seconds, some references will say 1 hour. Ano ba talaga? Ang bagong tinuturo ngayon, sabi nila, up until the first full breastfeed. So after the first full breastfeeding, pwede mo na kunin si baby, pwede mo na siyang i-measure yung mga anthropometrics, ibigay yung mga kailangan mo ibigay na vaccine, pag tapos na siya mag-first full breastfeed. However, your first full breastfeeding, it happens at around 30 minutes onwards. So basically, parang ganun din. Parehas lang din yung sinasabi natin before. So 30 to 60 minutes, okay? So the recent guidelines, ito yung sasabihin sa inyo, at least 1 hour or up to the first full breastfeed, okay? And speaking of breastfeeding, guys, yung iba kasi paglabas ni baby, pagpatong kay mother, minamadali, okay? Minamadali na mag-breastfeed agad yung baby. That's not going to happen. Remember, your baby will have to adapt to the changing environment. Nasanay siya sa loob ng tiyan ng mother, ngayon nasa labas na siya, okay? And some references will tell you this, merong 9 phases na dinadaanan si baby, okay, to complete the cycle of the first breastfeeding. Do we use this in clinical practice? Hindi yan, madalang yan guys, this is more of theoretical knowledge, okay? So I won't discuss these 9 phases, but what I want you to know again, it will take time, okay? Hindi yan paglabas, pagpatong mo sa chest, imumudmud mo yung ulo ni baby dun sa breast ni mother para dumede siya para tapos na yung trabaho mo. Sabi dito, after the first full breastfeed, pwede na pala. No, hindi ganun yun, okay? So you have to let the baby adapt, acclimatize to the situation outside the uterus, and let nature take its course, okay? After a while, makikita niyan, may mga feeding cues na yan, maglalak siya, tutulungan mo na siya, okay? After the first full breastfeed, after 1 hour of skin to skin, okay, this is what you have to do. You have to do your measurement, complete physical examination, okay, of course, your maturity scoring or your Ballard scoring, your erythromycin, your eye care, vitamin K prophylaxis to prevent vitamin K deficiency bleeding, your hepatitis B, okay, you have to do your Apgar score. Please remember again, the Apgar score is retrospective. So, tinatandaan mo lang yan, hindi yan yung paglabas ni baby, yun yung unang mong gagawin. No, what you have to do paglabas ni baby, not to do your Apgar, it's to stimulate and dry the baby, to do your EINC, okay. Again, remember, for well babies, Apgar score, we take it at first minute and 5th minute of life. So, 1 and 5 minutes. Hindi yung paglabas pa lang. Paglabas yun guys, in-Apgar mo agad yan, pagkakalabas pa lang sa puwerta ng mother, mababa pa yung Apgar score niyan. 1 minute, okay, first minute of life, okay. If the baby is stable, continue your skin-to-skin contact, okay? And room in the mother. So very important, we have to room in the baby with the mother. So hindi na uso yung practice dati na nauuna si baby or nauuna si mother sa room, dapat sabay sila, okay? Doc, can we do all of this pag cesarean section ang mother, okay? Kapag cesarean section, pwede bang mag-EINC? Ideal, yes. Pagpapalitin nyo lang yung steps 2 and 3 ng EINC nyo. Ano ba yung step 2 and 3, di ba? Toro drying, skin to skin, cord clamping. So babaliktad, mauuna yung cord clamping pag cesarean bago ka mag skin to skin. Pagka-clamp mo ng baby, again, 1 to 3 minutes pa rin, pwede mo nang dalhin si baby papunta kay mother, doon sa chest ni mother. Usually sa likod yun ng anesthesia blanket, okay? So pwede pa rin, okay? By experience, medyo mas mahirap, okay? Medyo pag cesarean yan, mas mahirap, hindi dahil kay baby or dahil kay mommy, pero usually yung setup. Usually yung mga obstetrician, yung mga anesthesiologists, ayaw nila na naabala, okay? But guys, I encourage you, for those watching this video, pag kayo na yung consultant, pag kayo na nagpa-practice, please, okay? Please do your EINC, please do your skin-to-skin contact, okay? Prevents hypothermia, prevents complications, and studies will show you that those who are able to do skin-to-skin contact, the success of breastfeeding is 2 to 3 times better than those who did not do skin-to-skin contact. Doon pa lang, sa simula pa lang, ang dami ng advantage. So that's why we have to do this EINC, okay? So, sabi natin, after your skin-to-skin, after your first full breastfeeding, you have to do your complete physical examination. Okay? And I will not go into detail isa-isa kung ano ba yung mga dapat yung examine. Usually, alam nyo na dapat yan. What we will discuss next are the unique physical examination findings that you may be able to see in a newborn para alam nyo kung ano yung mga kailangan nyong hanapin. Okay? Okay. So, vital signs is very important. This is the normal values for newborn. So, please remember these. Okay? BP, we do not routinely take it unless meron kang circulatory problem. Kung nag-shock yung baby or may ibang problem siya. Okay? Dagdag nyo na din dyan yung pulse oximeter reading, yung SpO2. So, ina-advocate natin ngayon na i-check nyo lahat yung SpO2 because there have been studies that some critical congenital heart diseases may be diagnosed very early. And that's very important if you do your routine pulse oximeter reading, lalo na sa mga newborn. Again, remember, it takes around 10 minutes or more bago umakyat ng 90 to 95% yung SpO2 ng newborn. So, wag kukunin na masyadong maaga. Papanik kayong baba. Normal pa yun. Okay? When you do your HEN PE, your head neck PE, okay, please take note of the fontanelles, okay, the normal sizes and shape. Your anterior fontanelle, this is a diamond-shaped fontanelle, sa anterior part ng ulo ni baby. That's usually around 1 to 3 centimeters. If it's too big, it's too small, maraming conditions ang pwedeng associated such as hydrocephalus pag masyadong malaki. The posterior fontanelle is smaller. Usually it admits the fingertip, okay, so it admits the tip, pero it can also be closed at birth, okay. And usually tinatanong sa rounds, when does it close? The anterior fontanelle closes at 9 to 18 months, so matagal, okay, 9 to 18 months yan. Whereas your posterior fontanelle closes earlier, 8 weeks. So tinatanong dyan 8-18. So yung posterior is 8 weeks, yung anterior is 18 months, okay. So again, the posterior may be closed at birth, okay. Neonatal teeth, so from time to time, we will see newborns na may ngipin, okay? So, normal lang ba yun? No, it's not. Pero anong ginagawa dyan? What's the problem? Well, kung minsan it interferes with latching, with breastfeeding, and lalo na pag yung mga ngipin ay parang nakalaylay na or matatanggal, delikado yan kasi pwede mag-aspirate. So, most of the time, we have those removed, okay? So, you refer the patient to your dentist, okay? Subconjunctival hemorrhages can be a finding in your newborns when you examine the eyes, okay? So, for most of the time, they are benign condition. You just have to observe these, okay? When you do your chest and abdominal PE, you check for the murmurs. Again, very early on, there can be physiologic murmurs. Katulad ng ductus arteriosus, you can hear that because sabi nga natin, ilan ba yung physiologic closure niyan? The functional closure of your ductus arteriosus happens at around 14 hours pa. So, baka magtaka kayo, kalalabas ng baby, parang may murmur, mahina lang siya, okay? Tapos kinabukasan wala na. So pwede yun. Baka yung ductus arteriosus lang narinig nyo, okay? You look for retractions, signs of respiratory distress, alar flaring, but please also remember, yung mga babies na maliliit, mapapayat, minsan normal na pag humihinga sila parang may mild retractions, okay? So, doc yung baby parang may retraction siya, pero yung RR niya within the normal range naman, nasa 30s, wala siyang alar flaring, maganda yung utusas, comfortable yung baby, hindi siya mukhang takipnik, okay? Then probably that can be normal, okay? And then when you do your PE in the abdomen, check nyo kung yung mga gross deformities such as gastroschisis or omphalocele, like the one in the image there, diba? That's omphalocele, may sac siya. And then you check the umbilicus as well. The normal anatomy should be AVA, diba? So 2 arteries and 1 vein, like the one showed in the picture, okay? You also check for your genitourinary PE, very important to check if the testes are descended in males, okay? And you check for the patency of the anus. And also note, if you see images like this, if you see findings like this, ano yan, if you have ambiguous genitalia. Again, very important, if you have a patient with ambiguous genitalia, you have to rule out endocrinopathies, endocrinologic problems, okay? Then you palpate and check for spinal abnormalities. So it's very important, when you examine the newborn, you have to really touch the newborn, you have to really feel it, okay? Kakapain nyo yung fontanelles, i-check nyo yung bunganga, yung likod, makakalimutan yan minsan, okay? Because sometimes you can have diseases that are very obvious, such as this one, myelomeningocele, okay? Or sometimes it can be occult, such as your spina bifida occulta, which will only present with tufts of hair at the back. So you have to examine that, you have to know that during your PE. If you have a patient wherein you're suspecting hip dislocation, you have to perform your Barlow and Ortolani test. Okay? Are you familiar on how to perform this test? Okay? So guys, si Barlow, basically guys, to make things simple, medyo nakakalito kasi yung dalawa. Si Barlow, ang gusto mo kay Barlow, you want to dislocate. Okay? You want to dislocate the hip, okay? To check kung nadi-dislocate siya. Si Ortolani, ginagawa mo yan to return it. Okay? Pag may dislocated yung hip mo, check mo kung kaya siyang ibalik. Okay? And how do you do this? Remember, Barlow is adduct. Okay? So you have to flex and adduct the hip, sabi dyan. Okay? And apply light pressure on the knees pababa, directing it posteriorly. So if you flex mo yung knees, okay, adduct it towards the middle while applying pressure downwards, light pressure downwards. A positive test, what happens in a positive test, your femoral head dislocates posteriorly. So mafe-feel yun. Yung femoral head lalabas siya, madi-dislocate siya posteriorly. Okay? Ortolani's test, on the other hand, so na-dislocate mo na nung ginawa mo yung Barlow, okay? Ortolani's test, ibabalik mo siya. So what happens? How do you do it? You flex the hips and knees at 90 degrees, okay? And the thigh is gently abducted. So yung kanina AD ducted, ito AB ducted. So dahan-dahan mo siyang, parang nakabuka ka, di ba? So igagano mo siya. So yan. So gently abduct it para bumalik yung femoral head na nag-slip palabas, babalik siya paloob. Okay? So if the femoral head reduces into the acetabulum, that is a positive Ortolani's test. And you usually do this test together when you're suspecting hip dislocation in newborns. Okay? So here's a sample of my admitting orders that I use in practice. Okay? So pag kayo yung admitting resident, admitting intern or clerk, this is what you can write. So basahin lang natin dahan-dahan lang natin. So I usually put the name, the date, and the time of birth, which is very important. Okay? Lalo na pag nagko-compute ka na ng mga fluids. I put the balance in numbers for there. So yan, admit to room of choice. Okay? Depending on the institution, usually what we do is to monitor the vital signs every 15 minutes for the first hour of life, then Q1 for the first 4 hours, and then Q4 another after if stable. Okay? I ask my patients to be weighed daily. Again, very important for newborns. I will discuss it later why. So yan, nalagay ko pa dyan, do not wipe off the lanugo, do not use baby oil, keep the patient thermoregulated. We do our newborn screening on the 48 hour of life, and the hearing screening usually prior to discharge. Tapos ito yung mga binibigyan natin, BCG, Hepa B, vitamin K, and erythromycin eye ointment. Okay? Sabi dyan, maybe the patient after 6 hours hindi na-updated yung orders ko. So 24 hours na yan. Okay? Skin to skin, uninterrupted, breastfeeding, so forth and so on. Okay? So, na-catch nyo na, stable siya, nagawa mo na yung mga kailangang paperwork, anthropometric measurements, and everything, okay na tayo. Now you do your daily rounds. So what do you do? What do you have to check kapag kayo yung intern or resident or clerk na naka-duty sa newborn wards? So what do you do? So of course, very basic, vital signs, given na yan. Okay? You do your daily physical examination. So that's very important. Kasi minsan may miss kayo during your initial PE, it's after 24 hours of birth, that's the time when you do, pag nasa rounds, nasa wards na yung baby, you do your complete and very detailed physical examination. And if there are significant changes, you have to note it in the chart. So note the physiologic changes, if there's positive jaundice, okay? If there's caput or cephal hematoma, you have to put in the measurement. Okay? Kasi alam natin na pag caput yan, dapat hindi na lumalaki yan. Pag cephal hematoma yan, lumalaki pa yan. Okay? If there are new onset murmurs, kung may mga ibang problems, you have to note that. Okay? Adequacy of milk feeding, very important. Okay? So again, we are advocating exclusive breastfeeding, but most of the time, lalo na pag first time mothers yan, you will hear mothers a lot saying na doc, walang gatas, okay, doc, walang lumalabas. So how do you ask and how do you document, how do you examine if there's adequacy of milk feeding? Sobrang dami. There are a lot of ways that you can do it. So one, you have to ask yung pattern of feeding, because a normal newborn will feed how often? The answer is, it depends, because the newborn feeds per demand. Hindi naman natin dapat inoorasan yan, okay? But ideally, every 2 to 3 hours. Kapag yung isang newborn, kunwari 8 hours lang hindi dumidede, then probably there's a problem, okay? So every 2 to 3 hours, pero again, it's per demand, okay? And then you ask, gano'ng katagal po bang dumidede? Saka, kamusta yung pagsak ni baby? Maganda ba? Good ba yung sucking niya? Because some babies will feed every hour, pero 2 sak lang, tapos na. So that's still poor suck. So you have to check if there's good suck. Usually, ilang minutes yan. Again, it also depends on the baby. Some babies will latch for 5 to 10 minutes, some will last for 30 minutes. So what's more important is if the suck is good, if the sucking is good, and Okay? Kapag meron kang signs na okay si baby. So, usually nakakatulog sila after mag-feed. Okay? And then, you compare that with your physical examination findings. So, you have to check if the newborn is not dehydrated. Okay? So, those are the techniques that you can do. Ask for the duration, kung good suck ba, ilang minutes nagsasak, and then check your PE. Okay? Ano pa? Ano pang ibang ways to check if there's adequacy of milk supply? Okay? Some will say, Doc, we can ask the mother to pump. Okay? Yes, you can. Breast pump. However, very early on, guys, wala kang mapapump yan. Usually, magpapanik pala yung mother. Wala lumalabas, Doc. Okay? Because, what do you know from your theoretical knowledge? Diba? First few days, that's colostrum. That's around 10 to 15 ml per feeding lang yan. And that's the size of the baby's tummy. 10 to 15 ml lang yan. So, chances are, pag nag-breastfeed ng baby, naubos niya na yun. Wala ka na makikita. So, pag nag-pump yung mother, Doc, wala lumalabas. Okay lang. That's normal. Okay? So, instead of pumping, what can you ask or what can you do to verify that the baby is getting enough milk? You check the output. The urine output, which is around 2 to 3 times per shift. Bowel movement, okay, at least once. Pero yung ibang babies, lalo na pag establish na yung lactation ng mother, breastfed babies, usually they poop very often. Usually after feeding, magpupoop yan. Okay? Pero you see that, usually pag nakauwi na. Habang nasa wards pa yan, 1 to 2 bowel movement per day is good enough. Okay? So yan, sinabi ko na yung output. And the weight, of course. You have to check for the weight because that's one of your parameters to see if the baby is getting enough milk. Okay? And when you do your rounds, you also check for other problems encountered, especially fever. Okay, there's a lot of causes of fever in the newborn. The newborn can develop fever because of dehydration. It can be physiologic. It can be because of your ambient temperature. But the dictum is, kapag may fever yan, always rule out infection. So yun yung unang papasok sa ating isip, baka may infection to. Because that's very dangerous. You have to take care of the baby who has infection. Dapat magbigay ka ng antibiotics. Okay. So, sinasabi ko sa inyo kanina paulit-ulit, is your weight. You have to monitor your weight. Nasa admitting orders ko. Monitor weight daily. Why? Because there's what we call our physiologic weight loss. In the first few days of life, it is normal for the baby's weight to go down. The question is, what is normal? What is your limit? Okay? Kasi pag sobrang bagsak ng timbang, for example, 3 kilos. So, itong batang ito, yung example, small for gestational age. Sorry, low birth weight yan, 2.2. So, for example, 3 kilos pinanganak. After 2-3 days, naging 2.9. Is that normal? Yes, that is normal. Okay? Pero pag yung 3 kilos mo bigla naging 2.5, masyadong malakas na yung weight loss nun. Hindi na physiologic yun. So, you have to know the definition of physiologic weight loss, which is, for full-term babies, sabi dyan, it is 5 to 10% of the birth weight. Okay? And usually, they regain it after 7 to 14 days on the second week of life. Pag preterm, mas mataas yung allowable, 10 to 15%. And usually, they regain it on the third week, mas late, 14 to 21 days. Okay? What do I do to remember this data more easy? Okay? More easily. Okay? Ang ginagawa ko. Ang memorize ko lang, guys, 10%. Ang niyo, 5 to 10, 10 to 15. So, ako 10% and up to 2 weeks. So, again, if you want to be off, those are the numbers. Pero ako, when I do my rounds, para hindi ko makakalimutan, 10%. That's my cutoff. 10% weight loss for the first 2 weeks that can be considered physiologic. Pwede pa yun. Pwedeng normal pa yun. Okay? Sabi rin sa libro, weight loss of 8 to 10% should be of concern. So, yun nga, pag umaabot ka na dun sa limit mo ng weight loss, then you have to check, you have to see why the baby is losing so much weight. Okay? So, again, guys, this is for the first 2 weeks, ha? So, for example, yung baby mo, 1 day old pa lang, nag-lose siya ng 10%. Malamang, ang normal na yun. Okay? And your average weight gain is around 20 to 30 grams per day. You do this on follow-up. You compute on follow-up. So, after the 14th day of life, guys, so sabi kasi dyan, yung pinanganak na 3 kilogram na baby, so mag-compute tayo at 3 kilograms, he is allowed to lose 10%, which is 300 grams. So, pwede siyang bumagsak up to 2,700 grams. Pero, on the 14th day, dapat na-regain na niya yun. So, dapat yung 3 kilos mo, bumalik na siya. Nag-follow up siya sa'yo on the 14th day, 2 weeks old, dapat nasa 3 kilos siya pataas. And from that day onwards, dapat nag-gain na siya ng 20 grams per day. That's what we used to compute, 20 grams. Okay? So, for example, may pumunta sa inyo, pinanganak na 3 kilograms, nag-follow up sa inyo na 3 weeks old. Ano dapat yung timbang niya? Theoretically, ideally. So, 3 kilograms, on the second week of life, dapat 3 kilograms na siya ulit. And then, third week old na siya ngayon, 3 weeks old na siya, so 7 days, 20 grams per day. 20 times 7, 140 grams. So, dapat at least 3,140 grams siya pag nag-follow up siya, pag 3 weeks old na siya. Okay? So, very technical, no? Very nitty-gritty ang neonatology. So, nakatuwa siya. Very exciting. Okay? You check for the urine and the bowel movement. We all know this. Output is expected yung urine for the first 24 to 30 hours. So, beyond that, pag wala pang ihi, abnormal yun. Okay? Bowel movement, mas late hanggang 48 hours pwede. So, first day, walang pupu. Okay lang yan. 36 hours na, wala pa rin pupu. Sige, baka pwede pa. Pero pag more than 48 hours na, you have to check why that baby is not having passage of meconium. Maraming possible na sakit. Meconium plug, Hirschsprung's disease, dami yan. Okay? Let's go now to some common findings that are considered normal or transient for pedia na pwede nyo makita during your rounds para alam nyo kung ano yung sasabihin nyo dun sa parents pag nag-rounds kayo. So, you may see this in some newborns, okay? Usually, lumalabas to after mga 3 days of life. So, ano ito mga to? Para siyang pustules, vesicles on erythematous base, okay? Napagkakamalang folliculitis, sometimes binibigyan ng antibiotics, pero yung bata walang lagnat. Pinacheck yung CBC, normal. The baby is active, doing well. Guys, this is your erythematoxicum, okay? It is considered transient, okay? Not really normal, it's transient. You don't have to do anything, you just have to observe. Of course, make sure na hindi nga siya infection, okay? Some babies might have this. Pag check nyo, doc, sabi ng mother, may lumalabas na gatas sa kanyang breast. That's what you call your witch's milk. Okay, tingnan yung baby, gulat na gulat. Sabi, shit, bakit ako may gatas? Gulat siya, gagawin ko dyan, didedeng ko ba yan? Okay, that's your witch's milk. Okay, I've seen 1 or 2 cases. Again, wala lang ginagawa yan. Observe and reassure. Okay? Very common. Some mothers will panic, will go to you, doc, may dugo yung ihi niya, red staining urine in the diaper. This can happen in females and males. Okay? Is this blood? No. This is urates. Okay, the urates present in your urine, lalo na pag concentrated yung urine ni baby, pag hindi pa established yung lactation, okay, what you do, again, observe and reassure. Okay? But you have to make sure that it's not really blood. So, what I tell my parents, okay, so mamitignan nyo kung talagang mukha ba siyang blood clots, okay, tapos kung paulit-ulit ba siya, it may recur, pero usually guys, after 1 or 2 episodes, nawala agad yan. Kapag persistent, na ganyan yung kulay, it's good to do your urinalysis and check kung talagang blood nga ba yung nandun. Okay? So, for most cases that I've seen with red staining urine because of your urine urates, usually yan, after 1 or 2 episodes, 1 or 2 days, mawala na. Papansin ng mother yan, Dok, kayo na umaga, parang nagbansa yung diaper, pero nung buong magdamag, parang okay na siya. Okay? So before discharging the patient, make sure that you've done your newborn screening, ideally, on the 48-hour of life and beyond. Okay, and then your hearing test as well. That's both; those are both mandatory. Okay, and finally, we will give our discharge instructions. So guys, na-discuss na natin kung paano mo siya i-catch, ano yung gagawin mo paglabas ni baby, pag stabilize mo na siya, pag nirarounds mo na siya sa wards, and now what do you do when you discharge your baby? Okay, of course, you instruct them to do daily newborn care. Kailangan mo paliguan araw-araw? Yes. Hindi ba kasi diba? Akala nila ito kakala ko every 3 days mo pag newborn. No, you have to do your daily newborn care. Cord care. Ano bang pinalilinis na ideal? Alcohol, betadine. Actually guys, most journals will recommend just simply soap and water. Pag pinaliguan niyo si baby, okay na yun. Okay? Yung mga pagbe-betadine, paglalagay ng kung ano-ano, alcohol, medyo outdated practices na yun. Okay? But still okay. A lot of pediatricians will still recommend alcohol cleaning it. Pero yun nga, soap and water, pag pinaliguan, pwede na yun. Sun exposure to prevent jaundice, that's very important. Okay? So, ano yung isang practical tip na kailangan nyo ituro sa mga magulang kapag in-instruct sila? Mami, parawan niyo po everyday. I see this a lot. Okay? Parawan niyo po everyday. Pagbalik ang dilaw ng baby. Madilaw siya. Okay? Pinaparawan ko po, Dok, 2 to 3 times pa nga gaya ng sabi niyo. Okay, mami, paano pinaparawan? Lalabas ko po. Pero nakabalot. Balit na balit yung bata. Okay? It will not work. Dapat i-instruct din na dapat tatamaan yung skin nila ng sunlight. So, dapat nakahubad. Okay? Ideally, kung kaya nga, hubad na hubad. Pero sige, diaper, lagyan mo ng diaper. Dapat nakahubad yan. Dahil yung mga patients na yan, pag yung kunwari pinaparawan na nakabalot, makikita nyo, yung mukha niya, hindi madilaw. Pag check nyo ng katawan, madilaw yung katawan. Kasi yung mukha nila inaarawan. Okay? So, that happens. Okay? So, again, instruct them properly. Okay? Exclusive breastfeeding per demand, that's a given. And you ask them and instruct them what are the things that they should watch out for. So, dapat hindi maglagnat si baby, dapat good yung suck niya, dapat dumudumi, umiihi. Okay? These are the things that you should tell the parents so that they know when to bring the baby back to you if there's a problem. And very important, you do your discharge PE. Okay? So, i-check niyo yung weight niya, ilagay niyo sa baby book yung discharge weight of 2.9 para pag follow up, kukomputin mo kung tama ba yung weight gain niya. Okay? Wala kang murmur na narinig para pag balik niya, nagilagulat ka, bakit may murmur to dati? Wala kang narinig. Okay? So, do your discharge physical examination and write it in the baby book. And of course, the follow-up schedule. And when do we follow up these newborns? Ideally, guys, sabi dun sa PPS recommendations, kapag yung newborn ay pinauwi mo ng less than 24 hours, sorry, less than 48 hours, kasi some mothers would like to be discharged very early. So, after 24 hours pa lang, pinauwi mo na siya, ideally, you should see that baby within the next 48 hours, so within the next 2 days. Okay? So, kapag na-observe mo naman ng okay yung baby, for example, nag-stay siya sa hospital, like cesarean si mother, 2 to 3 days, then you can adjust the follow-up as needed na medyo mas malayo ng konti. Okay? In practice, what do I do? Usually after several days, less than a week for me. So, I want to see the babies after around 3 or 4 days, okay, to assess them. Okay? For me, it's more of to assess the adequacy of breastfeeding, adequacy of feeding, kung hindi sila nag-jaundice. Very common, one of the common reasons for readmissions in newborns would be jaundice, kung masyadong naninilaw sila. Okay? And during follow-up, that's where we discuss the things that we need to talk about, such as vaccination, okay, supplementation, pag 6 months old na, and so forth and so on. Okay? So, that will be my last slide. I hope this session is informative and